Anyone who raised chickens will understand how depressing it is when their chicken got sick. If you are now raising some chickens, probably it's one of your biggest concerns too. A serious disease outbreak could wipe out your entire flock in a matter of days. Some disease won't kill your birds, but will result to poor performance, low efficiency, and ultimately economic loss. Good news is that poultry diseases are preventable. Today, we'll talk about how chickens can get sick, how we may treat it, and how we can prevent it. Chickens may get sick due to bacterial infections. Harmful bacteria may cause a dozen types of illness. E. coli, Salmonella, Haemophilus periglonerum, and Mycoplasma gallisepticum are among the most contagious and is responsible for great losses in poultry industries around the world. These bacteria will cause damage to the chicken's vital organs, including the heart and the liver, causing chronic respiratory diseases. If allowed to remain untreated, may ultimately end the chicken's life. Bacterial infections are highly contagious. If individual birds are seen with clinical signs, it is wise to assume that the entire flock is already infected, and treatment be given as soon as possible. Symptoms range from difficulty breathing, fever, reduced appetite, reduced egg production, rapid weight loss, and sudden death to swollen face, swollen wattles, and swollen joints. In early detection, broad-spectrum antibiotics is effective for treatment. Dosage should be according to body weight, and duration must be 5 to 7 days continuously. There are two types of antibiotics in action. One is bactericidal and the other bacteriostatic. The former kills the bacteria while they can still reproduce, reducing their numbers each day until their population reach zero, which takes around 5 to 7 days. While the latter does not kill the bacteria but stops it from multiplying. Eventually the bacteria dies out naturally in around 5 to 7 days. Vaccinations is still the best way to prevent infections, followed by good sanitation and strict biosecurity protocols. Second cause is virus. Some virus only cause diseases to the birds at a certain age, while other may cause illness at all ages. Details on each viral infections, symptoms and clinical signs will be on another video, which we may release later next time. Viral infection symptoms is very similar to bacterial infections. It is also highly contagious and can spread rapidly in the farm. And antibiotics is useless for treatment. Most viral infections are self-limiting, resulting in either clearance of the pathogen on its own or death of the host. Most outbreaks last no more than 10 days. However, secondary bacterial infections may occur, and the use of vaccine seems to be the only way to stop reoccurrence of disease outbreaks. There are mainly two types of vaccine used at present: the live vaccine and the inactivated vaccine, more often referred as killed. Live vaccines contain live attenuated microorganisms, which are still capable of replicating within the host. The microorganisms are weakened, meaning that they have lost most of their disease-causing capacity, but are still in possession of their immunogenic properties. Live vaccines are cheaper and gives rapid immune response. However, antibodies also drops down fast, approximately. Protection lasts only about 4 to 6 weeks. That's why booster dose is recommended. Excessive heat, sunlight, freezing, chlorinated water and other conditions can kill off live organisms, rendering them useless. They can be administered by injection, spray, in the water or by eye drops. Handling and storage of live vaccines is very critical. It has to be stored at a constant temperature of 2 to 7 degrees Celsius. Once it is out from cold storage and is prepped for administration, the vaccine had to be all used up within 90 minutes. Killed vaccines, on the other hand, contain no living organisms and are more stable in storage. Immune response is much slower and often needs a primer dose of live vaccine and a second booster shot after 9 weeks. After the booster shot, a lifelong immunity is expected. A sound vaccination program often has both live vaccine and killed vaccine. Third cause is parasites. External parasites are mites and lice. Mites feed on the blood of chickens and can cause anemia and possible death. Lice feed on dander and feathers. Infected chicken are often seen too busy scratching and lose feathers. Mites feed on chickens during the night and then hides during the day. Internal parasites are roundworms, tapeworms and protozoa. Large roundworms are the most damaging of the worms common to backyard flocks. A severe infestation can cause a reduction in nutrient absorption, intestinal blockage, and death. Parasites can cause poor growth and feed conversion, decreased egg production, and in severe cases, death. Also, parasites can make a flock more susceptible to diseases or worsen a current disease condition. Ivermectin is very effective to treat a variety of internal and external parasite, while amprolium is the drug of choice to treat coccidiosis, that is caused by protozoa. To prevent parasite infestation, clean premises regularly and quarantine any new chickens coming into the farm. Deficiency is the fourth cause. If your chickens has vitamin A deficiency, it will be very thin, weak and uncoordinated, eyelids stuck together, and decrease hatchability in their eggs. Vitamin D3 is needed for proper calcium and phosphorus metabolism and thus the formation of a normal skeleton. If either one of them is in deficiency, bones won't develop properly, resulting to lameness in chicken. Older laying hens are more susceptible to calcium deficiency, as they used up too many calcium in forming the eggshells. Osteoporosis results from calcium being removed from bone to meet other needs. The signs that your chickens are suffering from calcium deficiency are curving of the keel bone, soft or thin eggshells, and paralysis. Symptoms of a vitamin E deficiency include tremors, rapid contractions, and relaxation of the legs resulting in what is known as crazy chick disease. Other vitamin deficiency symptoms may be very similar to the ones mentioned earlier. For prevention, simply give regular supplements of multivitamins into their drinking water. For more mature laying hens, give an additional supplement of vitamin A, D and E. Giving them extra oyster shell grits or limestone grits in the late afternoon will help in improving eggshells quality and lessen chances of osteoporosis. Deficiencies of essential amino acids and protein will result in retarded growth or reduced egg size or egg production. If a diet is deficient in protein or certain amino acids, the bird may initially consume more feed in an attempt to resolve the deficiency. After a few days, this transient increase in feed intake shifts to a situation of reduced feed intake. Ask for lab analysis on the batch of feeds you purchased. If the required levels are not met, shift to another brand. If feed intake of your chickens is much below the standard amount, then it will result nutrition deficiency. Check at least once a week if the amount of feed they consume daily is according to their age. If feeds are given ad libitum, too much at once, the chicken may only choose to pick and eat what is tasty to them. As this goes on, they become picky eaters and tends to eat less in time. It is better to feed twice or thrice daily, and the feeds given must be all consumed an hour before the next feeding. The last cause may be due to fungus. Fungal or mycotic infections are common in all kinds of poultry birds, but are less prevalent as compared to bacterial and viral infections. Comprising of both yeasts and molds, it produces disease in two ways, producing pathogenic signs and lesions of disease by invading, harming and destroying body tissues of the host, and by producing some toxins known as mycotoxins. Mycotoxins enter the chicken's body through the food they eat. Improper feed storage may cause feeds to grow molds. Sometimes symptoms are confused as other infections since it is quite similar to bacterial infections. However, if you examine the chicken's gizzard and see signs of erosion, including the proventriculus glands, chances are it's caused by mycotoxins. The most effective treatment is removal of the source of toxins and administration of soluble vitamins and selenium. Mycotoxicoses may be prevented by careful choice of feed raw materials, reduction in water content of the raw materials and hygienic storage. Avoid keeping feeds in storage for more than 3 weeks. For cage-free farms, make sure the litter materials is mold-free. If you see molds already growing in the feeds, do not give it to your chickens anymore. If you have questions, please leave a comment below. Please subscribe for more videos in the future.